Now, correct me if I'm wrong, but Obama's plan, or part of it, would bar an insurance company from disallowing somebody due to a pre-existing condition,
That's right.
How would he go about doing that?
Well, what you basically say is that currently, for example, and when Judy gets elected, she'll learn about this too, 8 million federal employees and their family are under the Federal Employees Health Benefit Program. We can change insurance companies every year, no questions asked, no medical history. The companies, 250 private insurance companies, compete for our business. That's the way America should be able to look at health insurance. If you have a sick child who's born to your family tomorrow, that shouldn't disqualify everybody in the house from health insurance or run the cost up out of sight. So what Barack Obama is saying is that we are going to have pools that will include healthy people and those with a medical history. By pooling this risk,
would you want Obama or the new Congress to encourage the recruitment of doctors into the profession? I think, as Judy probably knows, that's been an issue. What do you think would be a good way to go about that?
Well, one of the things we can do is help some of these doctors pay for their education. The amount of debt that these doctors face when they graduate is sometimes crushing. They can't go and practice medicine where they want to. They have to figure out how to pay off that debt. Helping our young medical students find a way to finance their education without this crushing debt is one way that I think would be extremely helpful. We also have to start even at a lower level. We're not doing well when it comes to the teaching of math and science in grade schools and junior high schools and high school level. We fall behind the rest of the world. We need to have a greater initiative to make sure that there are more students who, if they have an interest in medicine, have a background in education which would allow them to qualify for medical school or nursing school for that matter. So there's a lot that we can do, starting at early levels in education, helping the students once they're in medical school.
Would that include, for example, in exchange for paying for medical school, working on, say, a salary for a while, or working in a VA type system for a while? Or rural areas?
What Barack Obama has suggested is an idea of national service, which will help students pay for their college education if they'll give a couple of years back to their country. The same thing is true when it comes to medical care. I know I represent downstate Illinois, it's a small town part of America, and we struggle to keep hospitals open and attract good doctors. I think we should create incentives for those who want to practice there so that we don't have to drive an hour to get to an emergency room. You know, whether you're facing a farm accident, a mining accident, whatever it might be, you need a hospital close at hand with good doctors. So encouraging doctors to come to those areas, giving them some help and forgiveness with their student loans, I think would be a good program.
Senator, I'm curious about the logistics of this plan. Barack Obama has said that he wants the same benefits as people in Congress to all of us. Logistically, how does this work?
You know, we've proven for 40 years it works. There are federal employees all across the United States, black, white, and brown, young and old, healthy and not as healthy, and we all participate in the same health insurance plan. And every year in September, we have an open enrollment. We can change plans. I've got 9 choices in Illinois. My wife and I take a look at them. We pick the plan that we want. The overhead cost is less than 2% of this. So what we're talking about is not something that's brand new and never tested. It's something that has worked effectively for 40 years for over 8 million employees and their families. And we spread the risk so that those who have a bad medical history or have some history of mental or medical illness, physical illness, still have a fighting chance to get affordable premiums.
And tell me, where is this money going to come from?
Well, a lot of it will come from within the system. You know, we have the most expensive healthcare system in the world. We spend twice as much as the next country. In fact, we could reduce that cost, and Judy has mentioned earlier, prevention is a major part of this. We really shouldn't just stack up all our money in the system for the sickest people. We should put money on the front end of prevention, childhood obesity, asthma, things like this. I might also add, we're this close to passing mental health parity on Capitol Hill, and I think that's long overdue. Currently, most health insurance programs, unless state law requires it, don't cover mental illness, and most mental illnesses can be successfully treated. So when I talk about health insurance, the future of health insurance is both for those physical maladies we've known over the years and now for the new mental illnesses which will be covered.
In the debate, Jim Lair asked which agenda items might have to be postponed because of this bailout bill or because of the focus on the economy. Senator Obama said health care wouldn't be one of those things. Would you say, as a high-ranking senator, that health care will remain an issue that will be on the agenda next year?
Well, Barack Obama has made it clear that when he's elected president, health care is not going to fall off the agenda. For the last 8 years under President Bush, we've had little or no progress beyond Medicare prescription drugs. And we really have to get down to the level where we're providing affordable health care. Middle-income families are falling behind. The costs of living for them are terrible. and healthcare is one of the added costs they face. Higher deductibles, more exposure out of pocket, and so Barack Obama knows that if middle-income families are going to have a fighting chance in this economy, we have to go after healthcare. Any more? Judy, want to add anything?
I do. I'm sorry.
I'd like to add on the healthcare workforce planning. I think that we need an overall healthcare workforce planning to go on nationwide, so that we have that will also help reduce costs. If we have the right provider at the right place at the right time with the right care, then we're going to actually be able to lower costs that way. There are many cost drivers within this system that we can lower the cost, raise the quality, and do better with the money that we have. That's why this debate does not have to come off of the agenda. We actually have plenty of money. It needs to be used wisely.
And just finally, obviously you're trying to be elected. How important is it to align yourself with the Obama campaign to get your name out as well with healthcare?
Well, healthcare has been what I've been doing as a state representative for 4 years, and before that, I delivered healthcare. I helped to make sure that we raised quality and lowered cost so that we could provide healthcare for more people. I've been doing that my whole life, so that's a cornerstone of my campaign and will be the cornerstone of my campaign as we go forward. I am proud to have Barack Obama with a really good, solid plan as we go forward, and I think the federal employees insurance plan is a really great way to go about that.
Thank you.
Anything else?
That'll do it.